A University of Washington thoracic surgeon fought hard to get Medicare and insurers to pay for lung cancer screenings for smokers. He says succeeding was one of the greatest achievements of his life. And while the number of eligible people who've taken advantage of early detection is pretty small, Dr. Douglas Wood says it's a good start. In tonight's Health Link, King 5's Amity Idrisi shows us the difference it made for one man.
Tom Boyle smoked for more than 40 years. Last spring, he went in for a lung cancer screening, and this fearless skydiver got news that terrified him.
I jump out of airplanes, right? No big deal. But when I heard that diagnosis, I have never been so afraid in my life.
Tom had a small cancerous tumor in his lung. He had surgery with no chemo or radiation because it was discovered early.
Lung cancer screening gives us the chance to take people that were previously lung cancer victims and make them lung cancer survivors.
Dr. Douglas Wood was on expert panels that convinced Medicare and major insurers to pay for lung cancer screenings for people between 55 and 77 who smoked a pack a day for 30 years or 2 packs a day for 15 years. And actually, he's not disappointed that only 2% of eligible people have participated.
I see that 200,000 as being a victory. Those are people that have the potential of early detection and a chance for cure that previously wouldn't have.
Traditionally, less than 20% of lung cancer patients survive. Early detection brings that up to 80 to 85% chance of long-term survival. Tom Boyle got that message loud and clear.
Instead of deciding, okay, where am I going to be buried? How am I going to be buried? You know, all the rest of that nonsense. No. It's like, okay, what kind of trips do I want to take? How many more times am I going to get out of an airplane?
Tom says that 15-minute screening gave him an extra 20 years of life.
Dr. Wood says educating patients and doctors about the importance of screening drives screening numbers up. He hopes that in 5 to 10 years, lung cancer screenings will be about as common as mammograms. Right now, the screenings are only covered for high-risk people. He says although 15% of lung cancer patients are non-smokers, the risks for screening outweighs any potential benefit. For HealthLink, I'm Amity Idrisi.